Hi, I'm Dr. Aya. Today I will be speaking about 4 topics briefly. The first topic will be epilepsy, followed by diabetes, and then asthma, and finally anaphylaxis. Let's start with the first topic, epilepsy. Epilepsy is a disease of seizures. Some students suffer from epilepsy and might get an attack of seizure at any time of the day. Now, what are the things to keep in mind as a first aider if a child gets a seizure attack? Things to be done are: first, move away any sharp objects from around the child. Anything that might harm the child, keep it away. The second thing is to put something soft, a cushion or anything that is soft, below the child's head to avoid any kind of injury to the head or the spinal cord. Third, turn the child to his side. Fourth, loosen up any tight clothing, especially around the neck area, to avoid choking. And finally, if you can, don't forget to time the seizure. This will be very helpful for the doctors and the nurses later. Things that should be avoided. First, never stop the seizure. If the child has an attack, leave the child, finish the attack, and then send him to the clinic. And the second thing is to avoid putting anything in the child's mouth. Avoid making the child drink water and avoid putting anything in his mouth. And the last thing is, don't panic. The second topic I'll be talking about is diabetes. Diabetes in children is mostly type 1. Type 1 diabetes is a child onset diabetes, and the main concern with diabetes type 1 is hypoglycemia, which is low blood sugar. How to detect low blood sugar signs in a child? The signs and symptoms include being dizzy, sweating, shaking, complaining of severe headache, complaining of severe tiredness, and just complaining of very fast heartbeats. If a child complains of any of these, please just send him immediately to the clinic. The third topic we'll be talking about is asthma. In asthma, most children might have already a chronic problem of asthma and they are already on their medication. But the main problem with asthma is if a child develops an acute attack. So how to detect an acute attack of asthma? Again, signs and symptoms include shortness of breath, wheezing, severe coughing. If the child is okay and he's able to speak, he will be complaining of severe chest pain or tightness. These are all signs of acute attack of asthma. In this case, also please send the child immediately to the clinic. The last topic is anaphylaxis. What is anaphylaxis? Anaphylaxis is a severe form of allergy. This kind of allergy can develop from any sort of allergens, what we call as allergens. Allergens can be anything from food, for example, peanuts, shellfish, egg, wheat, milk, and they can also develop from medications like antibiotics or different types of medications, and other things like insect bites. People who have anaphylaxis once or twice in their life tend to carry what's called as EpiPen. EpiPen delivers a medicine called epinephrine, and this is life-saving for the child. So, how to use an EpiPen? I will be demonstrating the EpiPen soon, but before that, let me just give you the signs and symptoms of how to detect anaphylaxis in a child. If a child, for instance, takes any kind of allergen, like let's say he's allergic to peanuts and he takes the peanuts, after a few minutes or even an hour, depending on different body reactions, the child will develop a rash all over his body, which is called hives. It's characterized by wheals, which are like red and bumpy, very itchy rash that spreads all over the body in seconds or even minutes. Associated with low blood pressure signs that includes dizziness, feeling fast heartbeats, sweating, shaking, and also the patient will be complaining of shortness of breath or wheezing. Any of these signs, the EpiPen should be used immediately if available. If it's a new case and the child doesn't have an EpiPen, please send the child immediately to the clinic and call the ambulance. As I mentioned earlier, this is what's called as the EpiPen. When you have the EpiPen, just open up the box. It's sealed, so you need to open this as well. And this is what's called as the EpiPen. You need to just remove the blue cap on this side, and the orange part is the needle where you will be inserting into the thigh. So you need to hold the pen firmly with your fist and then push it into the thigh. Hold for 10 seconds.